Hi friends, today we are going to discuss about an surgical complication or a surgery related complications, mainly called as abdominal adhesions. So if you come for any surgery, you may notice any kind of pain which may be intense or abdominal pain, nausea and vomiting. So today we are going to discuss about these abdominal adhesions one by one. Don't skip this video, let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
What is called as an abdominal adhesion? An abdominal adhesion is called as a band of scar tissues that can form in between abdominal organs, mainly in your small intestine. Usually, small intestines are affected due to these abdominal adhesions, and that can cause your tissues can stick together, which would go normally even after some days, but sometimes that may cause so much of complications. And what are the major organs that contains that included in the abdominal cavity? Mainly a digestive system that includes stomach and small intestine. And next part is female reproductive organs. And next is liver, spleen, pancreas. All these are the main organs that contain this abdominal cavity. So that's why this abdominal adhesion can occur even after a surgery, mainly an abdominal surgery. What are the major symptoms for these abdominal adhesions? Mainly, in abdominal adhesions, intestines will go for an twisting. That will leads to intestinal blockages, and that will cause symptoms like severe abdominal pain, and you may feel bloating, nausea, vomiting, and these are all the major symptoms that will felt during these abdominal adhesions. Because you have to note that in abdominal adhesions, mainly a small bowel obstruction will occur. This small bowel obstruction will leads to twisting of intestine that will cause blockage and will lead to these kind of symptoms. So these are all the major symptoms for these abdominal adhesions. What kind of test is mainly helpful to detect this kind of abdominal adhesions? You have to note that in abdominal adhesions there will be no imaging test will be helpful. Usually, an imaging test, mainly X-ray, CT, MRI will be helpful to diagnose whether you have any kind of intestinal blockages related to these adhesions. So, an imaging test will be helpful to find intestinal blockages. So, this is the major diagnostic test for this intestinal blockages. For the treatment, mainly usually a surgery will be helpful, but in so much of patients that doesn't show any symptoms. But in sometimes the patient may show symptoms like abdominal pain, nausea and vomiting. In this condition, a surgery will be helpful to remove the scar. So these are the major treatment methods, and that's all about today. Next day I will reach you with another topic. Thank you all. Have a nice day.